Professor Maggie Rae is the president of the UK Faculty of Public Health. Now, that's the standard-setting body for public health specialists in the UK, and she's with us now. Thanks for joining us here on BBC News. So, Professor Rae, good to have you with us. Public Health England, Professor Rae, it's gone. Will we miss it?
Well, I think that many people working in Public Health England need our thanks. And one of the things that I was very pleased that the Secretary of State, Matt Hancock, acknowledged was the excellent work that the people in Public Health England have been doing, and then again made commitment to those staff in Public Health England that he very much sees them as forming part of the new agency. So I think without the people, the organisation wouldn't succeed. So I'm delighted that the Secretary of State was so strong in his messages of support for the public health workforce.
How sensible is it to attempt this kind of reorganisation in the middle of a global pandemic?
Well, I think that's the sort of thing, Rebecca, that we're all scratching our heads a little bit about, because I know as part of the Academy of Royal Medical Colleges, we did ask the government to do a sort of rapid analysis and to look forward. And I have to say that they haven't engaged directly with us. So it's possible that they have made this decision in light of the knowledge that winter is coming and they're going to need a much greater and bigger capacity for public health. And with that, I would hope to see an awful lot more resources and funding going into public health.
Because, of course, the charges against Public Health England were that it was over-centralised, it was too bureaucratic, it wasn't nimble enough when it came to dealing with the coronavirus pandemic. Is any of that fair, do you think?
Well, it seems to me like a trial where Public Health England is announced as guilty when we haven't really heard the evidence. And I know from my own personal experience of public health across national, regional and local public health, that the Public Health England system works at all three of those levels, and all the local directors of public health who are also doing an absolutely fantastic job are actually supported by colleagues in Public Health England. So it does need Public Health England in the system to make it work. I think, though, there is some genuine confusion from the public, from ourselves, probably from you in the media, about who's responsible for what. And I think confusion and a lack of accountability and responsibility and clarity on that is not going to serve us well in a pandemic or any other point.
Well, I was hoping that you might be able to clear up one bit of confusion that I've got, because one of Public Health England's responsibilities had been looking after public health in terms of, say, obesity and alcohol and smoking. Whose responsibility will that now be? Do you know?
Well, I think that's an excellent question to ask, because infectious diseases going into the new agency is actually quite complicated, and there are many infectious diseases, not just coronavirus or COVID-19. So teams around the country are working on those infections and keeping the public safe. But you're now taking us into the area of non-communicable disease, and as we know, we've got really stark health inequalities in this country, and we've had some promises from the government about levelling up. So I think going forward, there was some indication from Secretary of State today that he would set up an advisory board, and I very much want to be part of that advisory board, so I and my colleagues in public health can help advise the government, but also to hold them to account for standards of excellence in public health. So I am expecting that we will see some arrangements put in place for the non-infectious diseases part of that agenda, because the country will be very badly damaged if those services are not in place.
Dr. Rae, the clock is ticking up to 7 o'clock. I wanted to squeeze in one small final question. Public Health England has collected a lot of data and intelligence over the past few years. What's your sense of what will happen to that?
Well, again, you've hit on a really good question, because without intelligence, data and knowledge needs to be turned into intelligence, and that's the basis on which we make decisions. We've seen that with all the information we've had about COVID. So that is vitally important. So yes, where's that going to go? Is that going to be split between the Joint Biosecurity Centre or with the new agency, or in some other part of the NHS and Department of Health? So we will be asking those questions. I will be asking those questions. And I dearly hope that these promises of greater investment will come into public health and make it stronger than ever.
Professor Maggie Rae, we must leave it there, but really good to talk to you. Thanks for talking to us on BBC News. Thanks.